As we age, many of us develop joint problems from osteoarthritis. But is it a good idea to have knee replacement surgery?
Boy, when you hurt, that's really what you're thinking of is do anything because my knee is killing me or my hip is killing me. We want to get out of pain.
Well, the first U.S. study that was done on the appropriateness of knee replacement surgery since an increase of 162% in Medicare-covered knee replacement surgeries in the last 20 years reveals that 1/3 of the surgeries are classified as inappropriate.
Yeah, well, there are a lot of factors that go into that. Some of it's patients saying, I can't take it anymore, just fix it. And they don't know about the complementary and alternative or the integrative strategies that are possible that could get people so they don't need to have a surgery.
Well, maybe we should talk about what some of those things are.
Oh, things like chiropractic and bodywork and acupuncture, infrared light therapy is a good one. The osteopathy works, bodywork is great, imagery, psychological counseling sometimes medications and supplements. There are lots of things, DMSO, another one. Lots of ways to approach managing pain from osteoarthritis. The other thing that's a concern is that a lot of doctors are really kind of eager to do surgery, and you have to wonder if they're doing it because that's what they do, and they're trying to solve it, and they don't know any better because they haven't trained for these integrative strategies.
And also because Medicare covers it.
Well, that has a lot to do with it. A lot of it's about income, and some of it's about turf wars. And yet, there are some very good doctors who won't do surgery until they're really convinced it's the best way to go. I've heard many orthopedists say, I don't think you're ready for a surgery. Let's see if we can do some other strategies first. Go back and see your primary care doctor and see if you can work that through.
But this is really something that only 44% of the surgeries that are done are necessary.
According to them, which means that there are 56% that they have doubts about. And they felt 34% were outright inappropriate and 22% they weren't sure. That's a very troublesome thing that shows a trend that we should be aware of as a consumer.
So it makes you wonder if it's a subjective or an effective procedure.
Well, I think that the procedure works, and sometimes it's the only thing that you can do to help people who can't get along. I've seen so many patients who have problems that they're limping, they're taking drugs for it, they're having a lot of side effects from it, and the quality of their life is terrible. For those people, that's a consideration.
I thought an interesting statistic was that 60% of the knee replacement surgeries are women that are around 67.
Yeah, well, maybe women don't handle pain as well. I don't know. I kind of doubt it. You go through childbirth, you can handle most anything. But it's something you have to observe and wonder about.
I'm wondering why people's knees are wearing out so much.
Well, I know why mine did. And
well, tennis, yeah, but not everybody pounds their knees on the pavement in tennis. And why are so many women having this?
Well, I don't know. It's a good question. I don't know.
I have several friends, actually, that have pain in their knees.
Listen, there are a lot of people that have orthopedic problems related to osteoarthritis or to injuries. And men are stronger and bigger than women. Their joints are bigger. They have more cartilage. Maybe that's what's happening. I don't really know the answer, and I don't think anybody studied it. So you'll have to keep on wondering about that question. So when we're looking at knee replacement or joint replacement in general, we should be looking at all the different opportunities we have before we start doing things that can have complications that are a real problem. Not every knee replacement or hip replacement that's done has a good result. I can vouch for that.
Yeah,
and I know that they've recalled 93,000 hips because they had metal-on-metal problems that led to cobalt poisoning that I went through. So I'm very appreciative of what can happen to a hip. And a lot of the knee surgeries don't come out right as well. But a lot of them do, and in general, they're procedures that are very effective. So I want to support them, but I think it's also good to get a second opinion and also get an integrative opinion from somebody who knows many different strategies for managing the symptoms that we get from osteoarthritis. If we do that, we'll be doing fewer knee and hip replacements.